Welcome to the discussion on cold weather and exercise. Print material regarding the topic can also be found in our education workbook available on the website. Today we will discuss the effects of cold weather on the body, precautions to take when exercising in the cold, and snow shoveling safety. When the skin is exposed to cold air or water, the blood vessels near the skin surface narrow or constrict. This redirects blood away from the surface of the skin towards the core. The body has a temperature regulating mechanism to maintain an internal body temperature, approximately 37 degrees Celsius for homeostasis, and therefore will protect our core organs. However, narrowing or constricting the blood vessels increases peripheral resistance and therefore increases blood pressure, requiring the heart to work harder. This can increase the risk of angina onset and other heart-related symptoms such as shortness of breath, excessive fatigue, dizziness, or arrhythmias. So during exercise, it is important that you monitor yourself for symptoms and always inform your exercise therapist and doctor of any new or worsening symptoms. For more information about symptom management, please refer to our Understanding Symptoms talk. Precautions for exercising in the cold. Perform a warm-up and cool down with each exercise session. This allows our muscles to increase in temperature, blood vessels to dilate, and allow an increase in the delivery of oxygen and nutrients to the muscles needed to perform its work. Just as important as the warm-up, you will continue to complete your cool down. A cool down can mimic the warm-up routine or simply slow your walking pace for the final 5 minutes. If you need to, you can complete these indoors. It may take time for your body to adjust to cooler temperatures, so it may not be time to increase your exercise prescription. You may actually want to reduce your exercise intensity or distance until you feel your body has adjusted to the temperatures. Be mindful of changes in the surface throughout your walk, in particular snow and ice on the ground. Consider exercising outside during daylight hours for better visibility of poor footing. And finally, refer to the cold safety index using the feels like temperature to determine if it is safe to exercise outside. Consider the presence or absence of sunshine, wind, precipitation, which can significantly affect the temperature. And if it is colder than -10 or feels like -10, consider an indoor option. Did you know cloud coverage can reduce the temperature by up to 7 degrees Celsius? So be mindful if you're venturing out for your walk close to sunset that the temperature can drop quickly. Consider exercise alternatives that are indoors if you're not keen on exercising outdoors through the winter months. Some options include shopping malls, large stores, or walking tracks. You can check out our community walking site list on our website for more details. Consider purchasing a piece of home exercise equipment. If you need help thinking of an option, speak with your exercise therapist. And also to consider exercise videos. There's lots on our website and lots of other options out there. If you are going to be exercising outdoors, make sure you are dressed appropriately. So for cold weather, we always want to make sure we are wearing our hat. This is the place that we're going to have the most heat loss. Consider wearing a scarf, neck warmer, or even a mask. There are little receptors on the backs of our throats that can detect if the weather is cold outside, and they further constrict our blood vessels. So by preventing this from happening and breathing in some nice warm air, make sure our mouths are covered. We also want to dress in layers to maintain our core temperature and also further prevent heat loss. So the layer closest to the skin we want to make sure is a moisture wicking layer. This layer transports moisture off the skin towards the surface of the fabric and therefore can be evaporated. So consider synthetic options such as polyester or nylon or your typical sportswear, and it doesn't need to be fancy because no one's going to see it. It is covered up by the next layer, which is our insulation layer. This layer traps the body heat to keep you warm, so use things like a sweatshirt, cotton sweatshirt, a wool sweater, or a fleece. On the outer layer, we want a wind or water resistance material. So this could be a raincoat or other jacket. Look for items that are labeled wind or water resistant. A non-insulated jacket is very important as we don't want to have our body temperature increase too much, so please prevent or resist wearing your winter coat. Also too, you can wear layers that have zippers so that if you do get warm through your walk, you could unzip the inside layer or the outside layer to have your own climate control. We want to wear mitts on our hands, not gloves, and we also want to make sure we're avoiding cotton socks. So again, we want a moisture wicking sock on our feet, or ladies, you could wear a nylon layer underneath a cotton sock. Avoid exercising in your heavy boots, but if you are concerned about the grip or traction, consider adding grippers or spikes to your running shoes. And for night safety, try to wear reflective materials and have a light on. Snow shoveling is a very demanding physical activity. Paired with the additional strain on the heart due to colder temperatures, individuals with cardiovascular disease are at increased risk of experiencing heart-related symptoms or having a heart attack while shoveling. So please consider snow removal services. Most townships or cities offer free snow removal services for individuals living with health conditions. So call or visit your city's website for more information, as these spots often do fill up. If you're unable to arrange for someone else to clear your snow, consider these safety tips when you are doing snow removal. Complete a warm-up before shoveling. Push the snow rather than scooping or lifting. If you must lift the snow, lift in small amounts. Consider how heavy your shovel is, maybe purchasing a lighter weight shovel. Take rest breaks or snow clear in small sections, or snow clear as the snow is falling to prevent it from accumulating too much. The longer that snow does stay on the ground, it tends to become wetter and more heavy, so removing snow quickly is important. If you have been prescribed nitro spray, it is important that you do carry it on you when you are snow shoveling. Let's test your knowledge. Which of the following statements is incorrect? A. Cloud cover can reduce the temperature by 7 degrees Celsius. B. Mittens are a better alternative to gloves when exercising in cold weather. C. Avoid wearing synthetic materials in the cold weather. D. In response to cold weather, arteries closer to the skin surface constrict or narrow. Or E. A warm-up should be completed prior to snow shoveling. The answer is C. Avoid wearing synthetic fabrics in cold weather is incorrect. We want to wear these types of fabrics close to our skin in our first layer. Are you working towards an exercise goal that can be impacted by the change in weather through the winter months? Consider setting yourself up for success by having a solid plan in place for when the weather changes. If possible, plan for a variety of indoor options that you can choose from and test these options before any inclement weather is expected. For more help on goal setting, speak with your exercise therapist.